Hey, Pusnet, new little video. And so I've been keep talking about doing my video on wounds and everything. It's in the process, it's almost finished, and most likely it won't be on my channel, but anyway, I'll do an announcement if it comes. But I think I did a good job. I hope I did a good job. Hopefully you'll Pusnet really enjoy it. I put all my heart in it. Anyway, this one is kind of like the part 2, which is actually will present as the part 1 of the part 6. Can you tell I've been working a little bit too much lately? Okay, so this video is a little bit, I think it's going to be controversial, but it's going to be my views on wound closure. So in wound management, there's kind of 3 ways of closing a wound. So what they call primary closure, secondary closure, and delay closure. So primary closure is what you see on YouTube all the time. So suture or other means of closure, and that's what we'll talk today about. But you'll see, I'll talk about why I don't recommend that part. But this is what it is. So first closure. So basically when you go home, when you go to see the doctor and they give like, mostly suture would be like 95% of the time, and the other 5% of the time, the other still, don't quote me on those numbers, just like, you know, about like this, the time that we see people and stuff like that. The second one is the ones I did my video on, which is basically secondary closure. So basically what you do is you let the wound heal itself from the bottom up, and you by putting dressings basically. And delay closure, it's kind of important, especially for what we do. So basically imagine that you're in the outdoors, you went to practice your skills or something like this, and you cut yourself. Or you get bite by an animal, you're a dog or someone else's dog or something like this. And you don't go to the hospital until about 6 or 7 or 8 hours, because by the time you got out and finally drove and everything. This is what they call delay closure. And I won't talk much about it, and I'll tell you why. It's because the literature keeps changing on that. It's not something that we should take care of in the field, because we're starting to talk about antibiotics and everything, and those would need to be assessed and managed by a healthcare professional of your liking, but somebody that knows what they're doing, has the mean of doing something about it. And like I said, literature keeps coming down. So before it was the 6 hours, now it's maybe 8 hours, and 8 hours for certain kind of wounds, but not those wounds. And so it's really like at this point, when you're in those kind of categories of wounds, so we're talking about animals bites, human bites as well. So if you get bites and things like that, those that are delayed, so that means long time between the time that you start closing them and got to facilities. So those ones you should go and seek professional help to deal with them. So we'll talk about the 2 parts. The second part, like I said, I did another video. So primary closure. You see a lot of YouTube videos on that. A lot of people talks about sutures and everything. And my video will be about, I don't like that way. For many reasons. And that's what I'm going to talk about. And a little section on wound irrigation as well. So when you get a wound, and especially you have to be able to assess, and I think I mentioned it in many different videos. Even in the field of medicine, wound care has its own like specialty, and a lot of even doctors, like last time, like I was saying, I went to a conference on wound care, and there was an emergency doctor over there, and they were saying like their training in wound management was maybe through like the whole, depending on the programs you do in samples, it's about 9 to 10 years of university program, and through that training, they got maybe 3, 4 hours he was talking about that maybe he got on wound management, which it's a big dove. Like when you start talking about like how many wounds we see in the emergency, but that's the training that they get. Wound closure, obviously, they get a little bit trained more, especially if you're a surgeon and everything. That's all they do. They can do it in their backhands and with your eyes closed and everything. They're just amazing what they do. But wound management as dressings and the secondary closure, they're very, very small training. Even at the nursing level, where we're kind of like the ones who do them, our training is insufficient. And especially even in emergency now, when you go to those conference and courses, you should see how many people from the critical care area that are just there, just like give me knowledge. They're like, they really want to learn about that stuff. So it's not common knowledge about wound care. And it's been also kind of given to home care and more like long-term care and everything. But I think there is a place for acute care, so meaning emergencies, ICUs, and even like now in the wilderness medicine, and that's what I'm trying to bring, is that there's a lot of dressing that they use in those houses and everything that would do marvelous for us and everything. So that's why I'm more big proponent of the wound management secondary closure than first sentence closure. So this is the big thing. The reason, another reason, is that for non-healthcare professionals, so the people that were watching my YouTube, if you have the knowledge of how to do it, you wouldn't be listening to my channel, to videos like this, because you're looking for how or what I can do, or I have a little bit of knowledge and things like that. So it's like, so that means that if you're not from a healthcare professional, you don't see that very often. And the thing is with wound closures, that if you close the wrong one, you can get into troubles. And I'll talk about it a little bit further down. But you need to assess the right depth, the right wounds to be closed with them. Do they have the proper hedge on it? And what technique you're going to use, what kind of, like for example, if we talk about suture, what kind of suture you're going to use, which one you're going to take, what technique, what not. So there is a lot of questions and assessments that comes. It's not just the technique. It's again one of those, knowledge doesn't equal experience, and that's one of them that sure. Suture, and again, Google like suture, and you'll have about, I don't know, 26,000 hit on people showing you how to do the technique, which is great if you want to do it. But the problem with this is that it's only the technique. They don't explain to you all the complications. They don't explain to you all the risks with it. They don't explain to you how to assess that you need to do the suture, when the situation is better for suture or non-suture, about what I'm talking about, the first, secondary, or third, or delay closure. I don't think in most of the video I never heard about explaining this way. And so it's not just about closing the wound. It's about what's going to be in the wound when you close it. And that brings me to the second issue. If I go to the emergency to get suture, and actually, right over there, that little white line, there, that was a nice hockey accident. I'm Canadian, so I play hockey. But basically, all this here, I got a skate that passed in front of my on my arm there, and so basically it was open about that size, and so they closed it. And as you can see, they didn't do too much of a good job because it was in a hurry. But that's for a story for another time. But when you closed that, it was in a hospital with all the proper gear, all sterile and everything. If you do that in the field, the chance of you having clean or more sterile stuff is very low. I mean, you may like pretty infected those things. And the problem also with this is that if you don't clean it properly, and that's why I'll show a little bit of video on irrigation, is if you don't clean that properly, there's two types of microbes out there. Well, big categories, there's tons of them, but there's two big categories of them, which is aerobic and anaerobic. So aerobic, so aerobic, is that basically they can live, like right now on me or something in the air, they can live. They don't get killed by oxygen. Anaerobic, anaerobic, is that they, when they get in contact with air, they will be killed. They cannot survive with this. So imagine now, and most of them are living obviously not in the air, so they live under the dirt and things like that. So in dirt, there's a lot of anaerobic stuff, which are, and in the anaerobic, they're nasty. Like some of those infections, they're like nasty, nasty stuff. So let's say I have a wound here, and I go and close this. What did I just created? I just cut this from the oxygen. If I have any anaerobic, anaerobic infection in there, I just said party on. I just open up this thing, close it too early, and now they can just multiply if they want. Doesn't mean that it's going to happen all the time. I mean, you know, when this happened, it didn't happen stuff. But it is higher risk, and especially if you're in the wilderness setting and stuff. So those are the ones that you would need to be assessed. And again, that's where it comes back to the experience and knowing what you're doing and having the antibiotics if there's a complication for those, and which one and which antibiotics to use and everything. So that's why I don't like primary closure in a wilderness setting. The other thing as well that I want to bring for that video is that the gear that you have to bring is pretty much single, like, so the suture kit would be, so this is actually a real suture kit, as you can see, it's even in the sterile pouch and everything. So you would need about this, and that would be like one type of suture. And this, like I said, like you have like different scissors and stuff like this in there. So this would be pretty much the only use you would have for this. I carry something else, and I'll talk about it on the second part because I see now I'm getting close to my time again. What do you want, French and Italian, eh? What do you want to? But so yeah, so those it becomes like pretty heavy of things that you need to carry and stuff like this. And that's why I don't recommend. And so basically, what I'm saying is that for especially non-healthcare professional that don't have all the experience, because knowledge, like I said, you can read a book and stuff, and it will come. And I mean, there's tons of books on how to do stuff. You can even buy kits in medical stores on how to practice those things with videos and everything, which is great. But the problem is like the recognition of the symptoms. What is an inflammation? What's an infection? What's the complication of it? How deep it is? Should I close those ones? Because also what happened is that if you close primary instead of bottom up, like I've been talking in my past videos, but more like on the top, what you're creating is a space like this. And now anything that's going to happen, if you do like any pressure on it, your wound will open. So then what's the advantage of primary versus secondary? Aesthetic. And basically that's what it is that the wound with dressings will sometimes don't look as nice, but as you can see here, I did another, I opened my arm from here, and this one I didn't do suture or anything like this, and actually I have also one in my head over here. Yeah, I was a very troubled child. But, yeah, and